I count 'em.
Good evening. Good evening. Welcome to another Live with Dr. Dawn. I'm your host, Dr. Dawn Camila Brown, double board certified child, adolescent, adult, and sports psychiatrist. I'm a two-time best-selling author, producer, influencer, all things in creative mental health. So thank you all for joining me for another episode, season 5, episode 2 of Live with Dr. Dawn. This is a special broadcast this evening, and it's like no other. One, because I actually wanted to share a personal testament to you all today. I have a special guest that I'm going to bring in a moment, but first I wanted to share a few, a little bit of my story that's been happening over the past couple of years. So first of all, hey, listen, you already know what to do. Share this live with everyone you know. Let me know that you're in the room. I would love to give you a shout out. Let me know who's here, where you're from, where you're watching from. And don't forget to share at least 2 people that you know, okay? I wanted to dedicate this, October is actually awareness month for many, many things. ADHD awareness, breast cancer awareness, even domestic violence awareness month. And this month, I really wanted to talk about and empower Black women, particularly around my age. So I'm 44 years young. And, as Black women or women in general, but particularly Black women, because that's my culture and that's what I know, we actually deal with a lot of stuff, right? A lot of stuff. And when we're talking about medical things, we actually don't necessarily talk about them out loud. We may go to the doctor, get a checkup here and there, have a conversation with our primary care or OBGYN, even, and having just follow-ups, right? But who starts the conversation about, let's check in your mammogram. Let's do are you doing your self-breast examinations? Do you have a family history? Does this warrant additional testing? I don't know if you all know if there are MRIs of the breast, especially if you have a family history like mine or like my family history. Cervical cancer and fibroids, very common in African-American women, actually more common in African-American women than any other background, culture, or race. Fibroids affects us as young as 20 or early 20s, all the way up until premenopause. And then we also want to talk about just in general fertility, right? Especially people like me, mid-40s, single, not married. And, what do we think about womanhood and as motherhood? And is this something that we want to pursue as a single parent? Or is this something that we want to do as far as, marrying someone and having children or adopting? These are conversations that we should have within our circles. And are we having those conversations? Are we talking to the girls in our circles or whomever's in your circle, your trusted circle, about fibroids? Are you talking to your trusted circles and your sisters about mammograms and doing their self-breast examinations? How about fertility? Fertility is an interesting process to go through, and I know because I've been through it. So I wanted to share my personal story, because how can I produce a live broadcast where the actual goal is to always come to you as real as it gets, bring on influencers and prominent members of our community to talk about medical issues, social justice issues, if I cannot share my own story? And I'm okay with that. There's nothing wrong with me sharing my story, especially if it's going to help someone else. And so that's what I decided to do this evening, is share my story. So my mother, Dr. Sandra Urquhart Brown, may she rest in heaven in God's love, she actually passed 16 years ago. And my mom actually was my very best friend, right? Everyone tells me I look like her, and she was very influential in the community. She was a principal, a dean of admission. She was a doctor, a PhD, music. She actually directed 6 music choirs at our church and 2 other churches beyond that. I mean, this lady was phenomenal. And I don't say that just because she was my mom, but I just say that because she was who she is. And so when I grew up, that's who I thought, that's how life should be. And, I got a lot of things from her. And one of the things that I will always remember about my mom is that she cared about everyone that she engaged with. That's just what her spirit, who she was as a person. She would always give to others before even thinking about ourselves. I mean, when we were on vacation and away from the church, she would come back early. Our entire family would come back early from vacation so she could actually serve the choirs that she directed. And she was the minister of music at the church. So she was back at it. And so that was one of the things I remember about her, was just how she poured into everyone's lives. But another thing that I remembered, or as I got older and started to appreciate about a person that lives a busy life like that, is caring for their own self. And so my mom actually developed breast cancer and actually died of breast cancer 1 month before her 5th year anniversary. It came back and metastasized. And so, since my mom's death, I've actually been very proactive in helping those who actually have been survivors of breast cancer, and actually doing my own guided breast examinations every month, making sure I talk to my OB/GYN about, my breast, and also making sure I'm up to date on all the examinations that should be done. And so earlier this year, there was something that was found on one of my imagings. Now, me being someone that has been raised in a family, Christian values, and has always been taught this word of God to, hey, be anxious for nothing. I really honestly was not anxious for nothing. And I knew that, okay, Lord, this is something that I know I've been actually proactive about. I'm glad that they, found something so I can actually be proactive in understanding what's going on with my own medical health. And it turns out that it was non-malignant mass that was found early this year. And of course, I praise God going into the exam room and having that procedure biopsy done, and praised them all the way down until I got my results, and praised them again. But at the end of the day, it was actually very eye-opening for me, because this was something that my mom went through and the results were different, right? And so it was important for me that I had to continue to have these conversations with my doctors. And it was my doctor, Dr. Donna Woolfolk, that actually told me, hey, you need to get on board. We need to do imaging every 6 months. We need to alternate it between mammograms and MRI of the breast. You need to make sure that you stay on schedule. This is something that you just have to do, because you have a 20% chance of having breast cancer, because your mom had it. She unfortunately passed by it. And then your grandmother, her mom had it actually, and she lived to her 90s. And so it was important for me to follow those directions from my own doctor, who I trusted. But it was that conversation that also led me to other conversations. Dr. Woolfolk was the first time when I moved to Houston 13, 14 years ago. I actually had 2 doctors in St. Louis where I did my residency, my psychiatry residency program. I spent 9 years in St. Louis. Shout out to my St. Louis family out there. And when I moved to Houston, I was referred to Dr. Woolfolk by one of my trusted friends. And I will never forget that first appointment, because on that first appointment, she actually did an exam, and she said, hey, do you have fibroids? And I said, hey, I don't think so. I mean, I have a family medicine practitioner. I have an OB/GYN back in St. Louis. I was very, very regular and routine with my appointments, but this is my first time hearing this on an exam, not imaging, but on an exam. And turns out that I was diagnosed with fibroids. And so I asked my family, because this is what led to having a discussion with my aunt at the time, and some of my family, women of the family. And yes, we have a significant family history of fibroids. And so my fibroids were to the point where if she felt them on exam, you already know where that led, right? I had to have a myomectomy. And I'm going to actually have my guests talk about what that means and what's recommended and all these other type of procedures that are currently going on today for fibroid removal. But I've had 2 myomectomies to this date. And so fibroids is a very, very common condition that many African-American women deal with. Fertile, 40 years old, I think there's other F's that we learned about when we studied for our boards and understanding, fibroids and who's predisposed to them. But, they're more common than people realize. And I'm dealing with fibroids till this day. And at the point where I have to understand and choose and make some certain decisions. So that leads me to my next F topic, which is fertility. So, I've always yearned to be a mom. I actually had an exceptional mother. And one of the things that I wanted to do, eventually was to be a mom. And I knew that would come later in life. I knew I wanted to have stability in my life. I wanted to be able to provide security for my child. I wanted to be married first, right? And actually, then have a discussion and, hopefully have kids. But of course, our journey is not always how we want it to be, how we dreamed it to be. And there's no regrets that I have about my journey. I'm very happy, delighted in my life. God has been so remarkable. And so I have a beautiful niece as well. But it was something that I did think about. And again, having another conversation with my OBGYN, Dr. Woolfolk, and my dad. I invited my dad on this conversation too, and also the other conversations about my medical health, because I thought it was very important that we had that conversation, because I'm very close to my dad as well. And so in dealing and talking about fertility, I decided to freeze my eggs. Now, it's interesting because I thought to myself, well, if I had these type of conversations earlier on, how would things be now? And I want to encourage the 20-year-olds out there, the 30-year-olds out there, even the 40-year-olds out there who are able to actually freeze their eggs. And you're at a point in your life where you just don't know, like me, if I want to be a mom. Now, I only have about a couple of months or a year to figure that out, because I don't want to be 60 and have a child, right? But it allows me preservation, right? It allows me to make a decision based upon, my lifestyle, my situation, my stability. And if I want to have a child, at least I have a choice and an option to make sure that the egg that I'm harvesting is an egg that is healthy, and it's one day, maybe it'll be implanted and maybe I'll have a child, but at least I have a choice. And I thought that was important, particularly for my background, because I have fibroids, because I have a history of breast cancer, and now I'm in my 40s. And so tonight, this is what we're going to talk about. We're going to talk about the silent conversations that should be spoken out loud. We're going to talk about these things that hopefully you're talking about in your sister circles, whether it's within your sister circles or with your family, but definitely with your doctors. These are conversations you should be having, at least with your OBGYN or family medicine practitioner, internist medicine doctor. These are conversations that are warranted, all right? And hopefully you're having these conversations at young ages. You're never too young to have these conversations, because you never know how life is going and what direction it's going to lead you. And so I'm actually talking to my 40-year-olds, my 30-year-olds today, and I want to just encourage you that if this is something that it's been on your mind, but you don't have that trusted circle, please join in ours, because we want to basically just share with you some knowledge and information about fertility, about fibroids, about breast cancer, awareness. And if you're someone out there that is a breast cancer survivor, congratulations, God bless you. And we're here to support you. If you're someone out there who's been through the fertility process, I feel you, sis. I understand. You're someone that's dealing with fibroids like myself, and I'm still trying to make some decisions about this third go round. I feel you, sis. I'm here as well. So I want to go ahead and bring on tonight's guest, Dr. Mia. Dr. Mia is a really good friend of mine. I met her through the Medical Moguls Institute. Dr. Mia is from Birmingham, Alabama. She's a 2-time best-selling author and a founder and medical director of Mia Bella Wellness Center, where she provides superior and compassionate services to women and men, including hormone therapy, total wellness, weight management, and intimacy products or procedures, as well as gynecology for women and adolescents. Dr. Mia Cowan, also known as Dr. Mia, is among the country's most well-known and respected board-certified gynecologists. She travels throughout the world, speaking at corporations, conferences, universities, and churches on insights and strategies for improving the quality of life of women and men. struggling with weight gain, fatigue, and sexual dysfunction. Dr. May is highly sought after by print, online, radio, TV, media to produce a fresh perspective on how to experience everlasting intimacy through wellness. And I'm just so excited to have Dr. May on. You know, we've been on each other's broadcasts. This has been a long time coming. I'm so happy that she's here. So you all know what to do. Let's encourage our sister as I bring her on, Dr. Mia Cowan, and we're going to bring her on after this very, very short clip.
I'm Zane. I'm 7 years old and I have ADHD. Here's what having ADHD is like for me. When I'm in school, I often move around. A lot. Even when everyone else is sitting down. When my teacher is reading a story or talking for a long time, I'm usually doing something else. Sometimes that something else is talking to my friends. When others are playing a game and following directions, I'm doing my own thing. Hey, I have an idea, and I'm going to tell you right now whether it's a good time or not. This bugs my teachers and my friends. Often, I forget to do my homework. Other times, I remember to do it, but then leave it at home. When I'm at home and my mom or dad asks me to do something, I often forget. Even if it's something easy like pick up your shoes and put them away. I'll start to do it, but then somehow it doesn't get done. I know this isn't my fault. They know it isn't my fault. It's my ADHD's fault.
I got no rules, I count 'em.
Dr. Mia, hi.
Hey, how are you?
I'm well. Thank you so much for joining me this evening. And
Thank you for having me.
Yes, it's an honor, sis. Always an honor to have you on. Always an honor. So this has been a long time coming, and I'm so happy, and it's just been a relief to share, right? Because I think that these are topics that, I mean, we always talk, right? We have our girlfriend groups. We talk about what's going on. We may go to concerts and shows and talk about what's going on in each other's life. But, you know, I really want to get down to these conversations because recently I've had some people that have approached me about these topics, and I'm like, wow. Some people don't have these type of groups where they can really open up and talk about what it's like to be 48 and want a child, or talk about what it's like to have breast cancer and, you know, really want to understand, you know, what your future's like and what's next, or, you know, have conversations about these fibroids, right? So I'm just so happy that you're here so we can really talk about it.
Great. And it's one of my favorite subjects. So let's talk, girl.
Let's get it. Let's start with fibroids, Dr. Mia. So what is your experience with fibroids? Can you share with the audience what fibroids are and kind of what kind of, you know, I guess the medical behind it, the medical importance behind understanding this, you know, condition and how it can actually threaten fertility?
Okay. So fibroids are a benign overgrowth in the uterus. That's the way I describe it. Usually benign, like 99.9% of the time, you know, and they run in families. Black women tend to have them 2 to 3 times the rate of white women. We're more likely to have a hysterectomy, even when you correct for size, the age of the patient, and even similar clinical scenarios. We're more likely to have a hysterectomy. And so the way that fibroids negatively affect fertility, especially for Black women, is that one, we tend to get bigger fibroids. So you get the bulk symptoms like the pain and the discomfort, and then they may be much larger, like the size of a, 3 to 6 month pregnancy, so they get really large for Black women. And so the way that they affect fertility is that, they block the lining. So a lot of times, nothing can implant into the lining because of the fibroids. The baby or the embryo can't implant. And so for a lot of women, they will start younger for Black women. And so you start having surgeries to get rid of them. And it used to be that the major surgery was either a hysterectomy or a myomectomy. A hysterectomy, removing the entire uterus, and then a myomectomy, just cutting into the uterus to remove the fibroids, repair the uterus so that you can maintain fertility. But the biggest issue is that, this takes time. It usually they are worse when women are older, and now more women are getting pregnant at later ages because we're focused on our careers and we're trying to, like you said, be settled, be able to take care of baby and get married. So having multiple surgeries definitely can increase the risk of infertility. But at the same time, now the good news is that we have so many other options. So major surgeries aren't always necessary. And I think the main thing is for our women to be more educated about their options and to be able to find good doctors who are willing to work with them to maintain their fertility.
Yes, Dr. Mia. Yes, yes, yes. And I want to actually stop right there because many women have automatically been recommended hysterectomies.
Many. I get women all the time because I'm known as the doctor who will try to save the uterus.
Yes.
So yeah, I've operated on women with really large uteri, and I still can preserve the uterus most of the time. I have yet to do a abdominal myomectomy and end up with a hysterectomy.
Yes.
Because I definitely understand the importance of fertility when a woman wants it. But this too is another reason why I really counsel a lot of my women. If you're 25 years old and you're not married and ready to have kids, don't buy the Lexus, buy the Toyota and go ahead and freeze your eggs. Like my daughter would probably get frozen eggs for her 25th birthday gift. And that way, if you start having these issues with fibroids, which tend to get worse in the 30s and 40s, which now is the time a lot of women are trying to get pregnant, and then they go to try to get pregnant and realize they have all of these issues and concerns that have to be dealt with. So yeah, my new recommendation is if you can get those eggs frozen, just go ahead and get them frozen, and the earlier, the better the eggs.
Amen to that. And I want to point out here that it's also important to maintain your fertility or your uterus for a couple of reasons. One, fertility, but also because of estrogen, right? The natural estrogen that we create.
Well, so the estrogen actually comes from the ovaries.
Yes, exactly.
Yeah. So, and that is a very good point. We want to make sure that even if you have to have a hysterectomy, you're done with childbearing, that you don't just have those ovaries removed, because you're right. Having that natural estrogen in the body, as long as the body produces it, is necessary to protect the heart, to protect the bones, and then just for quality of life in general. So some women have to have the hysterectomy. They're done with childbearing, but leave the ovaries. We say that if ovaries are normal, taking them out before the age of 60, especially without a significant cancer history for you or your family, increases the risk of death from heart disease, because people forget about the huge impact that hormones play on protecting the heart in your younger years.
Awesome. Thank you so much for sharing that. So I love the fact that this is a gift to your daughter. I actually gained 20 pounds in 2 months because of my fertility journey.
Yes, I'm sure.
Thank God I only had to do 1 cycle, but I know women who've done 3, 4 cycles of, fertility treatments. And that, oh my goodness, I can't imagine, that as well, right?
Right.
And the cost, of the actual treatments, there has to be some changes made.
Right.
Because this is not a covered procedure. This is like a $10,000 journey or process.
Yeah, it is. So unfortunately, a lot of women won't have access to that option.
Right. So, you all listen, if you have teenage daughters or daughters in their 20s, like Dr. Mia is saying, this is a wonderful gift that you can all start saving for, preparing your daughters for. I think it's very important. We got a college fund, but we can also have funds just in case our daughter wants to be mother and she wants to delay, that process for her. I think that's a wonderful idea that you have for your daughter. Yes.
And a lot of us don't hear about that idea. So that's why I say it more frequently now, that is an option. And then you don't have to be rushed to marry the loser just so that you can have a baby by a certain time. You have time to wait for your husband to get to you, and you can still, reproduce. And even if you can't, you can have a surrogate.
Amen. That's right. Exactly. Let's talk about the different types of procedures for fibroectomies, Dr. Mia. Can you tell us
Okay.
about the options here?
Yes. So again, the most common is the hysterectomy, which for me is the last option, depending on, the size of the uterus, the quality of life for the patient. So the ones that I'm more excited about are the minimally invasive procedures. So we have one. We'll talk about procedures, but we'll also talk about other options too, just outside of surgery in general. So number one is the hysteroscopy and 𝘪𝗪𝗪. So that's when it's a uterus. So uterine fibroids can be located in 3 different places in the uterus. It can be in that thin sheath. We call those subserosal fibroids. They can be in the muscle of the uterus that contracts for a baby. We call those intramural fibroids. And then they can be in the lining of the uterus that we can see actually going through the vagina with the camera into the cervix, looking into the uterus, and we can see the fibroids there. And those can be removed minimally invasive with the outpatient small procedure called a 𝘪𝗪𝗪. And so this is very important because a lot of my women who have infertility, that's one of the first things I want to do is I want to make sure that that lining is free and clear for implantation. So doing this procedure allows us to safely remove the fibroids and polyps and not remove any of the underlying tissue that we will need for fertility. So that's one, but those are usually the smaller fibroids. They're not the bigger ones necessarily. The bigger ones tend to be more located in the muscle of the uterus. And so that's what can make the uterus enlarge. So we say a normal size uterus without a baby is about 6 to 7 to 8 centimeters at the most. But fibroids can make the uterus go as high as 28 centimeters. You know what I mean? Like a 7-month pregnancy. So it depends on where they're located. But then the next procedure would be a robotic myomectomy or laparoscopic myomectomy. So it's still a minor procedure, not the large incision, but you can remove the fibroids robotically or laparoscopically, and it's more of a minimally invasive surgery compared to an open abdominal myomectomy. And then we have the open abdominal, because some women, especially Black women, can have the really large fibroids that just can't be done minimally invasive. So that's when they get that C-section cut, the panty line cut. And then we go in and we remove those fibroids and we sew the uterus back up so that we can try to maintain fertility. And then the new and exciting thing is a new procedure called the 𝘖𝑠𝑎.
You're doing that, right, Dr. Mia?
Yes, I'm so excited to be able to offer this to women. Because for one, it's minimally invasive. So you go home the same day, just like the, 𝘪𝗪𝗪 and the hysteroscopies, you go home the same day. With the 𝘖𝑠𝑎, you go home the same day, and the recovery is about 5 to 7 days. So you don't have to take a lot of time off work. Women are noticing that by us doing the 𝘖𝑠𝑎, which is where we do 2 to 3 little incisions. And then we're using a camera and an ultrasound, so I can locate the fibroids with the ultrasound while I'm looking on the screen. And then I can put the radio frequency energy into the fibroid, and I know that I'm directly into the fibroid, and you can actually see on the screen when the fibroid has been desiccated or burned enough that it shouldn't be an issue anymore. And so for the women that I've done them on, they've been anywhere from a 12 centimeter size uterus to about a 14 to 15 centimeter size uterus. And some people are doing them even larger. And I'm sure as I do more and more, I will try to, tackle those more difficult ones. But the good news is that it has not shown to decrease fertility by doing that. But in my mind, the fewer surgeries you have, the better for fertility, because the more cuts into the uterus with abdominal myomectomies, that increases the risk for scar tissue. So we know that with any of these procedures, that if you have them, you're going to have a C-section. But my philosophy on C-sections is vaginal deliveries are overrated anyway. So with the 𝘖𝑠𝑎, women tend to notice improvement pretty quickly, anywhere from the first few days to the first few months. And we should see the fibroids continuing to get smaller and smaller, and the symptoms getting better and better for anywhere from 3 to 6 months after having the 𝘖𝑠𝑎 procedure. So it's been out for a while, about 5, 6, 7 years. But of course, I'm in Alabama, So it's kind of just the deal here. But in Texas, I think that's where it was started. That's where I went for my training. So now a lot more doctors are offering this great procedure. It's great for the woman who wants to maintain fertility, and it's great for the woman who's done with fertility, but in her 40s and doesn't want to take off to have a hysterectomy, but she can get rid of those symptoms with the assessor, and sometimes adding on top of that the hysteroscopy with the 𝘪𝗪𝗪 to remove the fibroids in the lining, and that can help control the bleeding as well as those bulk symptoms like pain during the cycle, pain outside of the cycle, significant pelvic pressure, pain with intercourse, which we don't tolerate that.
Right.
Nothing to mess up that intimacy.
Right.
And then it can cause severe anemia. So those women can get tired. And so it can negatively affect quality of life. But the good news is that we've come a long ways with fibroids. Now we have wonderful treatment options where it doesn't seem like the end of the world. You definitely can have a baby after having fibroids. And we should also talk eventually about some things we can do to control the growth of fibroids and to be as healthy as we can, to hopefully not overstimulate the growth where they get so large that they have to come out.
Can we talk about that, Dr. Mia? First of all, congratulations, right, for introducing this to the Birmingham, Alabama area. I have my aunts on here who had to live in Huntsville. And so,
really?
Yes,
that's
my mom.
That's my next Bella is in Huntsville. So tell them I'll be out there by them very soon.
I definitely will. I definitely will. And you're the third person that I know. So yes, I have a doctor friend here that does it. Dr. Pierre Johnson, who I actually went to college with, does it. And now you're the third person that I know is actually really, offering this procedure. And when I heard about it, first of all, a couple of years ago, it wasn't a viable choice. I mean, I didn't need it at that time, but because this is a person that had 2 fibroidectomies or myomectomies, right? You're talking to me who actually I had 2 myomectomies, and I was like, wow. I mean, medicine has come a long way, so I love to hear about this. But let's talk about fibroids. I mean, is there a cure for this? And what can we do if there's not a cure? What can we do in our daily life to actually minimize, fibroids if that's possible? Please give us some information about this.
So we can start with the diet. So with the diet, decreasing beef in the diet, and I recommend eating cleaner meats too. So eating your more organic meat, not the meats with all the additives and the steroids and the hormones in them, and maintaining a healthy weight. Because if you think about estrogen is stored in fat. So the more fat that you have, the more estrogen you have, and the easier it is to stimulate fibroid growth. So starting with the diet, increasing fruits and vegetables, mainly vegetables, green vegetables like your spinach or leafy vegetables, that's going to also help decrease the chance of them growing extremely. And also there are some other, the other things you can do, exercise, of course, because that's going to help you with your maintaining your weight. Vitamin A has shown to not necessarily increase the risk of fibroids, but it may have a negative effect on fibroid growth, which we want. So vitamin A definitely won't hurt. Vitamin D, a lot of women are deficient in vitamin D, but making sure your vitamin D levels are staying over that. Normally it's 30. I say keep them around 50 to 60. That's good for the immune system. So those are some simple things that we can do. The other things is if we know you have fibroids, we can monitor them more closely and make sure that we know that they're not growing and that you're doing some of these things to prevent growth. And then for a lot of my women, I recommend doing like the Mirena IUD when you're not trying to get pregnant. It's a great form of birth control. It's going to control the bleeding with fibroids better than a lot of the other birth control options. And now we have specific treatments that are hormonal for fibroids.
Yes, I'm taking one of them. Yes,
Cowan and myofembree.
Yeah. Yes.
So they have shown to decrease the symptoms associated, and just plain old birth control pills, the 𝕃𝕀𝕍𝔼 shot. Those are things that also help to kind of shut down the hormonal system. Your estrogen levels are suppressed when you're on hormonal therapy. So that in itself will decrease fibroid growth. And then we have an old medication called Lupron that works really well for, the symptoms that go along with fibroids as well. So we have so many different options out there now. That's the exciting thing. And then knowing that there are some things that you can do, because I have actually seen it. I had a patient who went vegan, but she went real vegetarian. Like she wasn't just supplementing her meat for carbs. And she was actually supplementing her meat with vegetables. She came to my office, and 6 to 7 months later, when she came back, I was like, wait a minute, your uterus seems so much smaller. And so I had to go back and look at her chart. And when I looked at her chart, I'm like, what did you do? Because I didn't give her any medicine or anything. She's like, I went vegetarian. You know, so I increased my vegetables and I decreased my meat. I don't eat the beef. I don't eat a lot of chicken. Definitely don't eat the pork. And I could see, like, within less than a year's time, the size of her fibroids shrink down.
Wow.
So I think the diet does make a huge difference. They say that soy milk doesn't have a obvious connection with fibroids, but soy can kind of turn over to estrogen. And I don't think it's just soy milk. I think it's the food we eat with soy throughout, like McDonald's and fast food, and a lot of the processed foods that you buy. If you read the ingredients, they have soy. So if you're overexposed to soy, it only makes sense that you would have more estrogen, which is not going to help the fibroids. It's going to make them worse.
Thank you. Thank you for doing that. Thank you for telling us how healthy ways of managing this, because you're exactly right. My OB/GYN told me a story of a woman who did the same thing. She did a lot of natural vitamins and just changed her diet, exercise, and she went from having a 6-month uterus to have nothing at all. Like, her thyroids were so small that there was nothing that needed to be done. So I can definitely agree with that. And hearing that story in your, patient story, that it can happen naturally as well. So that's important.
And your blood sugar level is affected too. So women who are type 2, and see, when you think about it, the really sad thing that I see is that our younger women are so much more unhealthy than we were in our generation. So I'm seeing like I've seen 22 to 26-year-olds with huge fibroids. So it has something to do with diet, because that is the generation of fast food and processed food. And the whole diet change with us. We had good food up until we were about in college, maybe.
Yeah.
You know what I mean? But these kids are starting eating McDonald's like at an early age on a regular basis. And so I'm seeing them getting the diseases that we usually get in our 30s and 40s. I'm seeing it in their early 20s. So that's going to make a negative impact on fertility for a lot of women. So just, really teaching them about wellness and living a healthy lifestyle, and why fast food is bad for you, and why food that God put on the earth in the natural state is better for you. All of those things are going to make a huge difference.
That's biblical. It is. It's written in the Bible what we're supposed to be eating now. So you're exactly right. Yeah. And I wanted to make that connection, because I think it was important. Thank you so much for coming back to that. You're seeing a lot of women at younger ages with this condition, that it actually is preventing their process of wanting to be a mom because of this condition, right? And so, that's so important, that moms out there, that you talk to your daughters, or if you're a 20-year-old, 30-year-old listening to this conversation, you talk to your sister circles about this conversation, because a lot of us are dealing with this, regardless. Right. And it's even more important to go to your OB/GYN with Dr.
Every year.
Every year.
Yeah,
Dr. Mia, because
every year you should be having your annual exam with the gynecologist, or if you have a family practice doctor that does your gynecology exam, you should be having a pap smear. You may not need a pap smear every year, but you need that bimanual exam, because it can be from one year to the next that I can have somebody with the normal uterus, and then the next time they come in, for their annual exam, they can have an enlarged uterus. And the sooner that we realize women have fibroids, the better, because we can start doing those preventive things to make sure that it's not an issue for their fertility and down the road for their quality of life.
Amen. Now, how can we relate all of this to breast cancer, right? We understand that there's different types of breast cancer, that those that are related to certain genes, like BRCA genes, others that maybe we don't know what's causing them, but we know estrogen is a common hormone that is seen in breast cancer, cervical cancer, fibroid growth. Can you tell us a little bit about just, breasts and what we should be doing as far as maintenance care, and what we should be doing at home every day?
Right. So as far as breast cancer goes, a lot of breast cancers are hormonal. So that relates to the estrogen and the progesterone that your ovaries are producing. So again, overweight women are going to be more likely to get breast cancer, and obese women, because they're going to have more estrogen. It hasn't really been significantly related to the way we do birth control now. You know, we don't use the larger doses that they used a while ago when we used to say that birth control caused breast cancer. Then genetics is huge. So if you have a strong family history like Dr. Dawn has, the best thing you can do once you have all your insurance business in order is to be tested to see if you have the gene, because depending on which gene you have, it does increase the risk of breast cancer as well as ovarian cancer, sometimes colon cancer, and other cancers as well. So you know, but living a healthy lifestyle works for everything. Maintaining a healthy weight works for everything. Eating a healthy diet decreases your risk of so many diseases, including breast cancer and all kinds of cancer, as well as fibroids and all the things that affect us negatively.
Amen. And these breast self-exams, how, you know, I talked to one of my patients who was 19 the other day. And I mean, I ask about everything. So have you done your breast self-exam today? She's coming in about anxiety. And I'm asking about a breast, right? And because I don't know who else is or not asking. I don't know who she's seeing, not seeing. So we had to have a conversation on breast self-exams. And I actually showed her how. Can you tell us the importance of breast self-exams and how that has led to the discovery of, you know, breast cancer, for example, and why that's important?
Yes. Somebody asked, what's the name of the test? Just go for genetic testing. You can see a genetic specialist and they will figure out which test you need. And now the test is way more massive than it used to be. So even if you had genetic screening in the past and it was like 7 or 8 years ago, you should probably get it again because there's some new genes and they can detect more with the newer tests.
And I want to say this, that men get breast cancer too.
They do. They do.
So,
it's
yes,
a small percentage, but they still get it.
Yes, exactly. So even the brothers out there, thank you, Anthony, for saying that. Yes. Yes.
So the question was breast self-exam. So yes, I recommend to all my patients, even though the literature doesn't say it, I totally disagree with the literature on this. I recommend they do a breast exam on themselves once a month. And what I tell women is if you're on birth control, like pills or NuvaRing or the patch, every time you start a new pack, do a breast exam. If you don't have a uterus anymore, do it on a payday. So just pick that day of the month, or if you're not on birth control, do it the Sunday after your cycle goes off. You can put it in your schedule and just plan it like you do everything else. And a breast self-exam, I say do it laying flat on the bed as well as standing in the shower, because your breasts feel different depending on your position. You are supposed to make sure that, you know, you're going to have one hand up and you're going to use the opposite hand, and you're going to make sure you touch every part of your breast, including under your arm. So don't forget, breast tissue extends up the arm. So you're feeling for hard lumps that don't move well or just changes. You know what I mean? A lot of times it's nothing. Most women have lumpy, bumpy breasts, and you're going to do the other side. And on that day, you're going to do it before you get out of bed. And as soon as you take your shower, you're going to get that done. And it's just going to become a habit to you, because a lot of younger, especially younger women, have found their own breast cancer, and older women and, you know, middle-aged women, by just doing a breast exam. And they may have had a mammogram 3 or 4 months ago. And then they're doing their breast exam and feel something. They're like, well, I feel something, but I just had a mammogram, and it could be breast cancer. Because, and you know, this cancer is showing up totally differently. It seems to be more aggressive. Black women tend to have the more aggressive types, and we're starting to see it younger and younger. So I say monthly self-breast exams. If you don't have a strong family history, I still recommend you get that baseline mammogram at 35. And they will tell you whether you need to keep getting them based on what they see on that mammogram. And then by 40, I say every woman needs a mammogram every year. At 65, it does go to 60. I mean, it goes to every 2 years. If you're low risk, meaning you don't have a strong family history. And you consider yourself a strong family history if it is your sister or your mother. You know, in those 2 generations, you can count your grandparents, especially if they have that generation under them too. And especially when it was before menopause that they were diagnosed with breast cancer. That's when you really get concerned about a genetic mutation, or, you know, it being having that genetic risk of having it in the future.
And Dr. May, we have a question. At what age should this practice begin for women and men?
Yeah, I would say when girls are 18 years old, they should start
Mhm.
getting familiar with their breast. And men is real easy to check. You can easily feel any changes usually. And then if some overweight or obese men may have to actually do that exam, especially if they know they have that family history. I would definitely do it. I don't necessarily tell men, but I think take care of your whole body and just pay attention to it. So I would say, 18, 19, start getting comfortable with doing your breast exams. And that way, if something changes, it's easy for you to recognize because you're familiar. If you feel something on one side and you're like, "Ooh, this feels weird over here. Is this something?" I always go to that exact same spot on the other side. If you feel it there, you know that that's kind of normal anatomy. But it shouldn't be hard lumps that don't move, and it shouldn't be something growing and changing.
Amen. And that leads me to this point. Our body often talks to us, we just ignore it. So, for example, when my mom actually discovered her breast cancer, she was actually very, she had iron deficiency because she had a history of fibroids, but she also was feeling some leg pain, right? And she was like, "What is this?" And so, we were like, "Go to the doctor, and see, check it out." And that's how her breast, growth was discovered. So,
Did she have a blood clot?
well, I think so. I think it was related to a blood clot. Yes,
Okay.
exactly, exactly,
Yeah.
exactly. And she has a history of taking, birth control over the years, and
And back then they were a lot higher in dosing, so that did increase the risk. But we didn't know that until we knew it, and it was late for a lot of women.
That's right. That's
Mhm.
right. So it's like Dr. Mia said, it's so important that at least you check in with your wellness doctor. I call them wellness doctor, if it's family medicine, internist, OBGYN, at least annually. At
And you
least annually.
And that's why you have to see one annually too, because they need to do a breast exam in the office as well. So
That's
you're
right.
doing yours once a month. If you notice something, you're going to let your doctor know. And then you should be coming to the doctor so that we can do a thorough breast exam. And then the mammograms start at 35 to 40,
Mhm.
depending on the woman. And then based on family history, they can start as early as 25, especially if you have a known genetic mutation or you have a really strong family history, like your mom had it in her 30s or 40s. You want to start, looking for it much earlier because, again, our food has changed. We're seeing it a lot earlier. And so we're seeing it in much younger women.
For those women who or men who've actually are survivors, right, of breast cancer, what can you recommend to them as far as just maintenance of their health in general, physical health? Is it the same? What you're eating? Of course, the maintenance appointments for reevaluation is a little different, right?
Mhm.
Schedule. But what would you recommend for this population?
So actually, I think that's a great question because so many women are getting breast cancer earlier. And so when they're treated with chemotherapy and radiation, they can go into an immediate menopause.
Mhm.
And so going into that immediate menopause, they're miserable. But now you've had breast cancer, you cannot take estrogen and you cannot take progesterone to help with a lot of your menopausal symptoms. But the good news, and what a lot of women don't know, is you can take testosterone. So you can do the plant-based bioidentical testosterone pellets that have the anastrozole in them, and it's already in the pellet. So the anastrozole keeps the testosterone from converting to estrogen, and it's shown to decrease the risk of recurrence of breast cancer by 40%. And to decrease the risk of breast cancer by 40 to 70%. So it does decrease the risk of breast cancers because of the receptors that it blocks that's associated with breast cancer. So this has been studied and it's the truth. So plant-based bioidentical hormone testosterone treatment is good. You cannot do estrogen ever again. You cannot do progesterone ever again, but you can do the testosterone pellets with the anastrozole, and that's going to help with the woman's sexual function. These women are losing sexual function at early ages because they're diagnosed so early. So it's going to help with sexual function and sleep and night sweats and energy and memory and focus, mood, joint pain, belly fat, and weight management. So there is hope. You don't have to live miserably because you have that history of breast cancer. We now have something safe and effective that's going to even be protective that you can use to, improve your quality of life. So I'm really excited about that.
This is awesome. I actually was introduced to the testosterone theory with women by you, when I actually watched a few of your broadcasts, and then we had conversations one-on-one about testosterone, because that was something that was never checked by any of my doctors. And
Right.
so now I started asking my doctors, check my testosterone
Right.
level.
What
To
it-
know what it is.
And the thing about them checking it is they look for a normal level. So here's my
Mhm.
philosophy. If it's under 80 and you have severe symptoms, replacing it does help.
Mhm.
So, and those are the symptoms I was talking about, the night sweats, the not being able to sleep. And that all starts happening in the late 30s, early 40s, but it's very gradual. So you may have a few nights where you don't sleep, and some nights you sleep well. Then you have a few nights where you have night sweats. Then you're not thinking about intimacy at all, which
Mhm.
negatively affects you and your relationship. Then you're not having the enjoyment of it. But testosterone replacement will help with all of that, decrease your risk of breast cancer. And for men, it decreases the risk of prostate cancer. It protects the heart, protects the bones, and decreases the risk of dementia. So I'm always like, so why would you not be on testosterone hormone therapy? See, I don't have hair. I don't have acne, you know, so if it's dosed correctly by a real hormone specialist that knows what they're doing and they're monitoring you closely, it's safe, it's effective, and protective.
So I'm hearing you saying this as maintenance for any women, right?
Yeah,
Is that
yeah.
what you're saying, Dr. Mia?
Yes,
Okay. I
definitely.
want to make sure, because people
Yeah,
come to
I
me
mean,
like,
I've been doing
"I'm
it since I was 38 and I'm 47, and I know my life is better because of it. That's why I have energy. That's why I can maintain a healthy weight. That's why I can get up at 5 o'clock, 5:45 in the morning and exercise, you know.
Yes.
So it really helps with your quality of life.
Wow. Thank you so much for sharing that. Are there any other tidbits you like to share as far as how we could live this, healthier with energy and vibrance? And, because a lot of things, when I see people, they come to me with depression or anxiety, right? Their sleep is off. So of course that affects their mood, and that affects their attitudes and, their mental clarity. How they eat is important. Exercise, I call, the two things we have to do is eat and sleep, and we must do that healthy. And then I'm also bringing the third, the exercise, because exercise is known to at least decrease the progression of any genetic abnormality that we're bound to have, but also help prevent chronic diseases or, maintain them from becoming, worse. So exercise, so important as well.
Yes, yes. But look, I wanted to say this too. It's so good for bipolar disorder, PTSD, anxiety, and depression. So my patients who have bipolar disorder and they do their pellets, they do so much better. So don't forget about that. And they have been studying the testosterone pellets for PTSD in veterans.
Yes,
Because it makes a huge difference. And I have a few patients who have PTSD. They do the pellets and they feel so much better. Their mood is better. They're able to sleep better at night. They're not having as many nightmares, So it really helps with mental illness. Not saying to get off your medicine, because I still take my little meds, my little neurotransmitter meds. I take those every day. But you can still have, my anxiety is so much better when I am pelleted. My patients like me more, and my staff like me more when I am pelleted and I'm hormonally balanced.
Pelleted. I like that. Let's go ahead and normalize that. Pelleted. And I'm going to have to talk to you off about the bipolar. I had no idea. I knew about the veterans, but I had no idea for other mental health conditions. So thank you for mentioning that as well, because that's important.
I mean, depression. I had a patient who hadn't been out of bed for like a year or two, wasn't going to her children's games or anything. And she started getting her pellets and it changed her whole life. When I saw her, she was going to games. She was happy. I mean, it was like, it changed her whole life.
Yes.
And then she stopped for like a year and she was back in the bed for a year. I'm like, now, why would you do that? And then she came back, but it makes for severe depression, it makes a big difference too.
And I educate, because of course I'm a psychiatrist, so I believe in, medications, but I also believe in how God made us and what's natural and what's not, and what we're not getting in our food sources or for our environment. So let's look at those natural things that we should be doing in a healthy regimen. And if we're not doing those things. So I actually started ordering about 3 years ago, started ordering testosterone on women. And it's just really, I mean, it informed me on how, this is important, hormone to order, but also like you're saying, people are just doing well. So I appreciate you sharing that. So y'all need to go ahead and ask y'all doctors that you want a testosterone level. Ladies, testosterone levels, men definitely testosterone level.
Yes.
That could be causing some of these mental health mood changes, as well as comfort of life, sexual, mental. Dr. Mia said it all. So if you miss it, got to rewind it after we're done here and catch it again. But definitely start having these conversations with your doctor. Yes.
And all those new onset adult ADD patients, low testosterone.
That's why I started on it 3 years ago. So I'm like, what's going on? This is before the pandemic. I'm like, wait a minute.
That's not right.
I know. I'm like, y'all coming out the wazoo. What's going on? But again, you know, I had to go back to my own education and learn, you know, as you know, when we're in this level, education is every day, right? You're always learning something. So just looking at the research and seeing few research out there about testosterone, but there is research out there. And I'm like, wow, you know, this was just something that was considered in men with depression. That's what we learned in school. But we didn't know how this actually can also cause some mental health conditions in all ages, in all, you know, in different genders. And so, yes, thank you for sharing that. I appreciate that. We got to normalize that.
Right.
I like that.
Still live a great life, still have great everlasting intimacy is what I say. You know, intimacy is what I say. Live well, age well, so you can experience everlasting intimacy. Because I plan on, like, the night before I die, having great intimacy.
I know that's right.
Up in heaven, okay?
Yes. And that brings me to my next one, Dr. Mee. I know you and your husband actually do a weekly show. Is that correct? Can you tell us about your shows and what you're doing so people can follow you? And
yes. So Ageless Intimacy is the one I do with my husband, and we do it a couple times a month. We're actually doing it tonight at 8:30, and we'll actually be on with Dr. Cree and Jay, so another couple, and we'll be talking about some couple stuff with communication, and we'll also be talking about some wellness stuff because we always make sure we hit on that. So yeah, we do that on Sundays, and you can follow me on Bella Health and Wellness, or you can always find me at Mia Cowan, MD.
Okay. So Mia Bella, and I had
Mia Bella. I know everybody say Mia Bella because of my name, but it's Mia Bella. I know
it's your name, right?
I know I mess everybody up. Mia Bella. So yeah, that's the and then MeBellaWellness.com. You know, if you need to find me and get more information, because I do virtual things and I do coaching as well. So that can span across the states.
Amen. And listen, my followers are really good about following my friends. And so you all follow Dr. Mia so that you can keep up to date on your health and wellness when it comes to you. You know, and I always talk to my adults and I say, listen, I know that when you became parents, our society says, you know, put your children first, but I just invite you to have a different perspective. Of course, your children are priority, they're important, but those people or those children that depend on you, they have to depend on someone who is doing well as well. So it's okay to prioritize yourself so that you can be there for your children, right? When they're at their best, you're at yours, right? So it's important to prioritize your wellness. So Dr. Mia offers so many solutions, you know, for women, for men, for couples. You know, I definitely want to follow her on MeBellasWellness.com, as well as, you know, her handle, Mia Bella Wellness. I apologize, Dr. Mia.
and if the other thing is that, you know, as Black people, we don't always get the same health care depending on who we go to. And that's just the reality. I mean, we know how we're felt about in this country. And if we didn't know, we know now for sure. So everybody doesn't get the same health care. So I get a lot of Black women in Alabama who are coming to me because they were told their only option is to have a hysterectomy. So I also will do consults. So if somebody wants me to go through their medical records, just see what I think, you know, and explain to them what I understand, because every doctor doesn't do that. They can just sign up for a consult, like even a total wellness consult. It won't be medical advice. It'll be what I understand on your medical records to give you some good advice so that you can make sure that you're being told the right information, because unfortunately, we don't always get the right information. Women in general, but especially Black women. There's a huge health disparity with Black people in America in health.
Yes, there is. Yes, there is. So you all definitely take advantage of that. You know, my family in Alabama, spread the word. You already know what to do. You probably be seeing some of my family members as well.
I get a lot of people from Huntsville, honey, a lot.
Yes,
like, let me come up there with y'all.
Okay. I'm telling you. because this is important. This is too important to ignore, you know.
Exactly. Fertility is important. Your body is important. And just knowing the things to, you know, the right things to do to maintain as much health and wellness as you possibly can. Let's just do our part, you know.
Exactly. Dr. Mia, thank you. Thank you for joining me.
Thank you for having me. I always enjoy it. Anytime, Dr. Dawn. And you know I'm going to have you on my show soon because I'm always talking about the mental health associated with intimacy and wellness as well.
I'd love to be.
I'll be bugging you soon, girl.
I'll be honored, girl. I'll be honored. Thank you so much. And don't forget to follow Dr. Mia, you all. Appreciate you all joining us. So yeah, my aunt Elnora said, yeah, for sure. You may see her very soon.
I'll be looking at you.
And she'll spread the word out there too. So Dr. Mia, thank you. Thank your family for spending the time with us, you know, away from your family. I know it's a common family night. I know you have a show that you're doing later. So don't forget to check Dr. Mia out, 8:30 Central Standard. Is that correct?
That's correct. That's
all
correct. On 𝑚eBella Health and Wellness, honey, on Facebook.
𝑚eBella Health and Wellness. And if you're following her, you already have you know where to go. 8:30. Right. So let's show up and show support to Dr. Mia and her platform. I appreciate you, sis. And Sora, I love you.
I know, I love
you soon.
Always a pleasure.
Pleasure's mine, honey. Thank you. And that's it for another Live with Dr. Dawn. Listen, I appreciate you sharing your time with us tonight. There are so many nuggets that Dr. Mia dropped this in the evening. So please feel free, as soon as this is done, go back and rewind. Look at it again. Look at it with your daughters. Send it to your daughters. It's important. And your sons and your brothers and your family, right? Because this affects everyone. Breast cancer affects everyone. Fibroids, fertility, very important conversation to have at an early age, particularly with women, young girls. So thanks again for sharing your time and your space. I'm so happy that you joined. Nora, Anthony, Sean, thank you. If I missed anybody, I know there were some other people on here who actually didn't just, you know, share anything, but I'm glad you're here as well. And you'll do me a favor, you just share this with everyone you know. We want to make sure we have access, that people have access to important and credible information so they can make informed decisions about their healthcare. All right. Thanks again, you all. Talk soon and can't wait to see you for another Live with Dr. Dawn. Bye.
Zombie apocalypse.